Hi there, this is Bradley Cole. I'm applying for Maria Drost Options Program Track and Combined Track. This is the video for my clinical case scenario of Taylor, so go ahead and get going. Due to the client making comments such as wanting to escape and for the pain to stop, a lack of protective factors, feelings of hopelessness, and the increased use of alcohol, I'd say the client is at a moderate to high risk. As I will mention in a minute, I would be more curious about suicidal ideation with this particular client. In terms of diagnosis, based on the information provided, feelings of hopelessness, depressed mood, difficulty sleeping, I am leaning towards a diagnosis of depression, but would need further information and assessment. Some individual and cultural characteristics of Taylor's that I noticed are they are an adopted, bicultural, middle-aged, high SES, physician, and parent. I do wonder more about their bicultural identity and which two identities they identify with, and I'm curious more about their gender identity. Regardless, these identities are important as they have shaped the way in which Taylor sees the world and interacts with others. Together, we can begin to explore their identities and how they have impacted the way in which they see the world. Through this exploration, Taylor can begin to reconnect with their entire being and begin the journey towards self-love and happiness. I'm curious about a lot with Taylor, but immediately I'm curious if they are experiencing suicidal ideation, as I need to ensure the client's safety before diving deeper into our work. To add to this, I am curious to know if there are any protective factors in the client's life, or if anything has worked in the past to spark joy or subside the anger and sadness experienced daily. Additionally, I am curious to know more about the increased alcohol use. For example, is it impacting the client's health? How many drinks per day? Is the client blacking out when they drink? Etc. In terms of their bicultural identity, I'm additionally curious about how this identity was discussed and treated in their adopted white family, and whether this impacted their feelings of being unwanted. With this, I am also curious to know if there are parts of their bicultural identity that they have neglected due to their upbringing. I'm also curious about the client's past trauma and whether I am the first person they have told about the abuse in their childhood. Finally, I am curious to know more about the relationships with their children. I'd like to know whether the relationship became distant only after the divorce, or were they loving, joyful relationships prior to the divorce. Also curious if there's any potential for reconnection to begin finding ways of bringing happiness and tranquility back into Taylor's life. Building rapport would be the main focus of my first session with Taylor. The client often feels like an outsider, that they are not wanted, so I want to create a relationship that shows Taylor that this is their space and I'm invested in their care and want them to be there. Through the bonding of client and therapist and showing Taylor that they are able to be wanted and included in a relationship, I hope that this first session can begin to raise the client's self-esteem and raise them out of their depressed mood a little bit. I do not want to dive headfirst into family trauma or intense emotional processing on our first session, but I do want to create a safe space free of the unwanted feelings experienced in their past. Thank you.